It's important to be a healthy person, but it's also important to be a healthy member of society. My name is Dr. Kristen Kokiko. I'm the Department Chair of Public Health. In our department, we have 3 different disciplines. We have public health, we have addiction studies, and then we have nutrition science.
Nutrition is actually an essential component in our public health system, and that is because as individuals, it hits every spectrum of our system. For example, in the government setting, we have certain populations that need to be educated about nutrition, like low income in certain regions of our county. If you are in the psychology field, for example, we now know that certain nutrients interact with their genes and have certain roles in our organs and can affect our mental health.
That's what I like about nutrition, is that it's a really big field. There's still so much that we don't know in terms of the science of it, and that's why I really like it, because I feel like the learning never stops.
95% of our students are in recovery themselves. So they are maybe coming out of treatment, they've been clean for some time, and then they will start, learning about our field, and then they go, and really the whole point that most of them kind of go and get certified through our program is because they want to give back.
In that major, it's just I'm finding new ways to help people in their addiction. I am an addict myself, so being able to explore what addiction really is and where it comes from and where it stems from is like, it's nice. And I want to be able to share my education about it to the next person.
You don't have to be in recovery to be in the addiction studies program. The other students, maybe their family member dealt with addiction, or they had a friend, so they were curious about it. It helps give them a better understanding of that as well. And then they kind of learn that this is a field that they are good at, and it's something that is fulfilling to them.
The reason why I believe equity is so important in public health is because when we look at who is healthy and who isn't healthy in America, there are some really big differences. Communities of color, low-income communities, and other communities that have been historically marginalized suffer poor health, and not through any fault of their own, but because of the way the environments around them are designed.
Our public health degree program is really exciting. We have a lot of educated staff, faculty. We really focus on helping students build those skills that they need to go out into the communities to help their communities be better, be healthier.
Public health is a collaborative effort. If you're working in public health, it's not just you, it's the rest of a big chain. It's about making a machine that runs perfectly in sync and tandem with each other. It has been really exciting knowing that we are the first community college in California to have a dedicated public health program.
We have 2 degrees. We have an associate's degree in health education, which it's going to be changed to associates in public health. And then we have a transfer degree in public health science. So both of those degrees will help students who want to transfer. In fall of 23, we're also going to have our community health worker certificate. I call them CHOWs.
So at the current moment, our program is expanding. We are adding an entrepreneurship component to our program. So we offer 2 degrees. We offer a certificate of nutrition, health, and wellness. Those are for students who would like to add a certificate as a great adjunct to their current field or their current degree. Other degree is our degree of Associate of Science for transfer in nutrition and dietetics. This one gives students the essential education to transfer to a 4-year university to study dietetics, something in the health field, dental hygiene, so some of those higher health professions that we often hear in our field.
Honestly, me as a public health professional, I don't have the solutions, I don't have the answers. The community has the solutions, the community has the answers. We're just there to lift up voices and provide tools so that solutions are enacted.
When you understand that we're all connected, right? This is our community. It's public health, so it integrates into every aspect of our lives. And the healthier that a student is as a person, then the better they are able to go and help their community.